Okay, we're recording, so we're ready to go. So good morning, good evening, good afternoon, everyone. My name is Maria Barbara Leon. I'm UICC's Chief Operating Officer. It's a great honor to be here with you. This is the virtual dialogue on UICC strategy review process. We're very excited because we have many people coming in. We have a record registration. So thank you for being here. I'm excited also to see that there's someone from Costa Rica because I'm from Costa Rica, a little disclaimer. So welcome everybody. This is a virtual dialogue addressed to members, but we're really excited because we also have non-members. We also have partners joining and it's great. And it's great to see the UICC friends joining and sharing with us different experiences and trying to learn about the strategy review process that we're conducting at UICC. So thank you so much for being here. I also would like to welcome the UICC staff to thank them because we've been working hard to deliver this workshop, this dialogue. So thank you, Alessandro. He's on the back end, making sure that everybody is in. Thank you, Muriel. Also, Muriel Claire, who leads the membership team with Laura and Shirin. They're busy also in the chat and in the background. So thank you so much. And last but not least, thank you to our speakers, Carrie Adams, our CEO, and Dr. Anil D'Cruz, our president. So welcome everyone. And as I said, we are on the virtual dialogue on UICC strategy review process. So before we start, I would like to remind you about some rules and regulations. Those that know me, they know that I like rules and I like following rules. So could we see the next slide, please? Yeah. So please remember, these are basic rules, but it's always nice to remind them. Please remember to mute yourself while you're not speaking and unmute yourself when talking. If your connection allows it, put your camera on because it's always nice to see faces, even though we're far away, but it's always nice to recognize those friendly faces. We could use the chat box on the bottom. So I encourage you to use it. And actually, I know some of you have done it already, but I would encourage you to put your name and the organization that you're representing and the country where you are, because it's always a great honor for us to know that we could convene that many people around the world. So please feel free to use the chat, and then throughout the dialogue also feel free to ask questions and to have comments. And then if time's allowed, we'll try to respond them. But if not, we are happy also to take it offline. And then last, we will be using Mentimeter, which is, for those of you, just a reminder for those of you that don't know it, it's an app that will allow us to better interact with the public, with the audience. It is good that if you have on the phone, or if you have another tab open on your browser. So without any further delays, I would like to introduce our president, UICC President Anil D'Cruz. Anil has been president of UICC since 2020, and he's been involved in UICC since many years. And as COO of UICC, it's been a great honor to work with Anil throughout his presidency and also on the strategy review. So Anil, the floor is yours.
Thanks, Maria. Am I heard well? Just show me a thumbs up if I'm heard. Lovely, great, thank you, good evening. Thanks, Maria, for setting the stage. I'm delighted to be president, and you welcome me, said kind words. You know, I was very proud when I got to be elected as the president, because I was the first Indian to be elected as president of the UICC. So one first, but I hope I'm not the first president who will be a virtual president. Hopefully by the conference, I would be there and we'll meet each other face to face. And I think one of the fun things about the UICC is meeting people, networking, exchanging ideas from all our members on cancer control. But without much ado, welcome to all, everybody who's joined. I was going to say UICC members, but it's heartening to see people from the agencies, friends, other people in cancer control who have joined this virtual dialogue to discuss the strategic review. It's really a delight to see such a diverse group of engaged members of the community. As the UICC president, and together with members of the UICC board, many of them who are logged in today, it is my pleasure to launch this member engagement activities focused around strategic review for 2022. With your support, with your inputs that we need, the UICC can work hand in hand with our Geneva team to ensure that the strategic review takes into account the different perspectives of cancer control from the membership. Can I have my first slide? Yeah, there goes. Yeah, the next slide. Okay. The UICC board does this strategic review once every 4 years. And the last time it was done during Sanchia Aranda's presidentship in 2018. At that time, we looked at the objectives over a 10-year horizon to assess the strategic risks and opportunities and agree with our CEO on the preferred strategy that we would adopt for the next couple of years. In this entire process, which we now revisit and we put a new strategic review, inputs from our members and people who are in cancer control is critical in this process. We are going through troubled times. We had COVID and now this new front opened in Russia. So there has been a lot of limitations on our activities. But having said that, it's heartening to see the cancer community rally around and continue cancer control efforts. Now, what we need from y'all is for y'all to share your views, strategies, as well as any relevant resource that we should consider in any area that could have an influence on cancer control. And when we say this, we are looking on a time period out till 2035. You could share this with the membership team now during this dialogue through the chat box. We will have time that we will give where we can exchange thoughts, or you can do it via email to the membership committee on the email which Muriel will put up in the chat box, and y'all can just follow that link and send it even subsequently. We'd like you to focus on anything in cancer control. It could be economic, it could be political, it could be civil society, engagement, whatever you feel is apt at this point as we shape our strategy over the next 4 years. There'll be various touch points that we'll have with y'all guys. There's this dialogue today. We then go into what we call the membership survey, where we'll take feedback from our members. We'll have focused interview with select people, and then we'll once again convene on a dialogue, something like today, before we finally crystallize on what our strategic review is going to be like. So I look forward to a very interesting and excellent hour, and I'm going to hand over to Carrie Adams, our CEO, who will share more background information. Thank you once again for all of y'all coming in, and welcome to the strategic review. Carrie.
Thank you very much, Anil. And it will be remiss of me to not point out that we have 3 ex-board members of UICC in the audience today. Miri, hello Miri in Israel, lovely to see you again. Hello,
Hello,
Mary.
hello to
Mary
you all.
Gospodarovich is in Canada, I assume. Hi, Mary. And I also know Ben Anderson is there as well. So Ben, great to see you again. So thank you very much for joining us. Really appreciate it. And all your good efforts will probably be reflected in my presentation. So let's move on to the next slide then. I'm going to cover a couple of pieces. First of all, give you an overview of progress so that we have a context for the next 10 years that we review what we should be focusing on over that 10-year period. Then I'll talk about the last review, the headlines that we had from that, and we'll also talk about what we're doing in the next 2 to 3 years. So I'll run through these slides quickly because, as Neil has said, we're interested in your feedback. So less of me and more of you, the better in the process. So some of us have been around for quite a while. I'm sure Ben Anderson and as well as Mary will recall a lot of this going back to 2010, where we've really had 3 components of our work over that period of time where we were once getting organized, secondly, increasing our influence globally as a community, and then thirdly, gathering momentum leading up to 2020. And we called that our roadmap 1, 2, and 3, but we stopped using the word roadmap in our last business planning cycle, which runs from 20 to 23. And we had reviews of our strategy in 10, 14, and 18, and Mary Gospodarovich conducted a review in 2014, which led to the change in the purpose statement, which I will go through later. So we've grown rapidly during that time of those 3 component business plan periods. We've launched many new organizations, some of which you'll be familiar with: the International Cancer Control Partnership, the Cape Center for Law and Cancer, NCD Alliance. We worked with the Spanish colleagues on World Cancer Research Day, and only recently launched City Cancer Challenge. So in addition to running the UICC, we've given the opportunity to create new organizations that have had an impact around the world. And if you don't know any of those organizations, I suggest you look at the websites and see how brilliantly they're all doing at the moment. Next slide, please. We've also worked diligently on the global health agenda, not least with our colleagues at the NCD Alliance. And you'll see on this slide, which we'll share with you afterwards, some of the wins that we've achieved during that period of time, including high-level meetings on NCDs, including cancer, updates of the essential medicines list, World Health Assembly resolution on cancer, and one on palliative care. And only a couple of years ago, we had the wonderful news that the member states of the World Health Organization would commit to eliminate cervical cancer over time. So there's been some major wins at a global level. And I think many of us will recall back in 10-11 when probably cancer wasn't featuring in the global health and development agenda, but now it is, and it's also part of the SDGs, which is great. And of course, we've taken our message around the world through the World Cancer Leaders Summit and the World Cancer Congress. Next slide, please. The World Health Assembly resolution was 2017. A number of years in preparation, commitment from all member states to ensure that cancer is a health priority in those countries. And we followed up diligently with member states and the WHO to make sure that that has meaning and it's not just a piece of paper. So one of the outcomes of that commitment was obviously the Cervical Cancer Elimination Project, which kicked off in WHO in 2017. And we are delighted to see WHO's engagement in cancer now, which is far more proactive and impactful than it was probably at the beginning of the decade. Next slide, please. Our membership has grown throughout. We were around about 340 members in 2010, and we grew to 1,200. And part of our strategic review process each time we've gone through it is to reassess how we should grow our membership base in a strategic way. Which regions do we not have membership in? Which types of organizations we don't have members in? And we've really diligently grown that membership base so that we can include all aspects of cancer control in our membership base to thoroughly represent the challenges that we see in improving cancer, reducing cancer incidence and improving cancer survival over time. Next slide, please. So we're going to move on, first of all, to menti.com. I'll hand over to Alessandra to explain how it works. But we are asking one question here, and it's going to help us because we're also doing a brand review at the moment. So we'd like to know what you think of the personality of UICC. So Alessandra, let me pass over to you to talk through how we're going to do this.
Thank you, Kerry. And obviously, as you can see, as you've seen from the previous slide, UICC has grown quite a bit over the last 10 years. So it's time to check in what kind of person have we grown in. Obviously, you might have have a relationship with UICC for many years, or you just met us recently. So all we're asking you through this quick poll is to define what would UICC is if it were a person with 1 or 2 words. So if you go on menti.com, you can use your mobile. It's probably the easier way. And you enter the code 68352467, as it's noted there. You should find that question and you can enter your answer. You can enter as many answers as you can think of. So probably we'll just give you a couple of minutes to think a little bit. If UICC were a person, how would you describe it? And in the meantime, I'll probably ask my colleague Shireen, who's our new member of staff from the membership team. So a welcome to her, to our first virtual dialogues. I'm sure you will get to know her in time. So we can see as the answer come in, we can read them immediately here as they come in.
There's some good words in there, can I say? So thank you very much for people being so kind with your words. I particularly like the one best friend, because I have no friends. So that's really nice. So thank you very much. With whoever said best friend, thank you very much. Anil, are there any words that are jumping out at you as you're looking at those? Oh.
I'm sure.
Big sister is a bit of a confusion one for me, but thank you very much for big sister. What about yourself, Anil?
Yeah. I sent mine, but I kind of wanted to add another one equivalent to big sister, basically getting all of us together. Maybe that's what they meant, getting the cancer together. That's the way I would interpret it, because I had something similar that I wanted, but I used a better adjective. You need to find that out, Kerry.
Okay. Well, there's some great words in there, so thank you very much. Alessandra, how long do we run this session before we move on?
I think it's fine. I think if you have more words, you're welcome to keep them entering, but we will collect all those and probably will pass them on also to our head of comms, who's doing, as Kerry mentioned, our looking at our brand and our personalities and organizations. So this is very helpful. Thanks, everybody. I think we can move on, and there will be another Menti question in just a few more minutes in a while. Kerry, back to you.
Great, thank you very much. If I could have the slides up again, that would be great. And thank you very much for participating. We want to make this a bit interactive, so you're all warm for the conversation a bit later. So we move on to the next slide, please. So as Anil mentioned earlier, we conducted our last review in 2018, and I don't want to present all the slides that came out of that, but it's probably worth noting that when we did the strategic review, we set our ambitions quite far in the future. This was something which Mary and her board set out in the first place, was projecting what the cancer world would look like in 2030, 2035, and then assessing what the key priorities were from then, and then adjusting UICC's operational model over time. And as I've said, if we come up with a strategic review which concludes that we can change things tomorrow to have an impact, it's not really a strategic review, because that's more of a business plan. We just do things tomorrow and make things happen. So we set ambitions for 2030. We felt that by the time we got to 2030, UICC should have an increased regional focus. Secondly, it should be addressing gaps through innovative partnerships. So continuing, as I said earlier, looking for opportunities to create new organizations to address big holes or opportunities that exist in global health. The third one was to focus again on capacity building, the continual role of connecting our members together to share best practice, to share good ideas, guidelines, etc. And the fourth one was to have a greater depth of relationship with the UICC members. And it's worth noting that in 2018, when that was discussed, the board was quite keen on UICC using the current technology to see how we could interact with our members far more than we were doing the face-to-face model. And somewhat ironically, and I guess a silver lining after a rather dark cloud of COVID, we were forced into doing that. And that is why this strategy review process for the first time includes virtual dialogues like this, so we can see and listen to people and get their views on UICC and feed that into the process run by Anil and the board. But I think you're going to see more and more of that over the next few years as UICC develops other ways in which we can connect through virtual means our membership around the world and our partners, to be honest, as well. We move on to the next slide then, please. So as I said earlier, we work on sort of a 3 to 4 year planning cycle. So once we understand the strategy, the direction of travel that the board wishes us to take, then it's down to myself and the management team to convert that into a midterm set of objectives and plans. So we take the strategic ambition longer term and we convert that into what can we do over the next few years to make that a reality. And that's bearing in mind that, you know, we can't just drop things. We have to continue programs or projects or initiatives that we're involved with, and then we move into the next plan, which will be 23 to 26 probably. So if we move on to the next slide, please. I'm going to cover what our key areas are for the next 2 to 3 years, which will be informed by this strategic review, and we may adjust as we get towards the end of the year. But you're probably familiar with the fact that we have 3 sort of areas of focus: one on convening, bringing the world together; secondly, on capacity building, which was brought out by the 2018 review; and in advocacy, which is a role that we've played for the last 10, 12 years while I've been here, which is about making sure that cancer is on the global health and development agenda. And not surprisingly, if we go on to the next slide, you'll see that those 3 components of our work actually reflect very clearly 3 components in our purpose statement. So we unite and we support the cancer community to reduce the global cancer burden, to promote greater equity and ensure that cancer control continues to be a priority in the World Health and Development Agenda. And that was slightly changed in 2018 because the original one was about getting cancer onto the Global Health and Development Agenda. But by 2018, the evidence was pretty clear that we had it there. It was a question of maintaining it. But you'll notice that that sort of covers convening, capacity building and advocacy. And so our world revolves around those 3 elements, and that will be part of the discussion the board will have in May when it convenes for a workshop to consider all the information that we collect prior to that meeting on whether this still applies as the absolute clear signal about what we're about as an organization moving into the future. Next slide, please. So under convening, you'll be familiar that we run World Cancer Day, and we've just closed the care gap, which was incredibly exciting to watch that ripple around the world. And thank you to anyone who's in the audience who actually participated or did something to close the care gap. That will be running for another 2 years. And we're very excited about that it growing and developing during that 3-year cycle. World Cancer Leaders Summit, which was run in Boston virtually. Unfortunately, we couldn't get to Boston, but it was supposed to be in Boston. But we ran that virtually last year, and we'll be announcing where the new venue is for 2023 in the coming months. And the World Cancer Congress, which those of you who joined in a little bit earlier, well, I announced it's in Geneva in October, and we'd like to see you all attend. Registrations are open at the moment, and they're cheaper than they would normally be because we want to encourage you all to sign up early. Next slide, please. In terms of the members' support, we have expanded our capacity building opportunities for our members. We've introduced, for example, the CEO program, the Young Leaders program, as well as our more traditional capacity building, like, for example, the fellowships. We've also focused on some key areas like breast cancer, et cetera, et cetera. We've moved to a digital platform. And we've also introduced work to do with cervical cancer as well. So a real uplift in all the work that we've been doing on capacity building in the last 3 to 4 years. And we anticipate that continuing and growing. Next slide, please. And we've also, at the request of the board, been keeping an eye on some longer term challenges and issues where UIC should have a position and engage. One of those is antimicrobial resistance, because in the longer term, as antibiotics do not work, the possibility of cancer patients dying from infection increases over time. So we've joined together with several very, very impressive organizations who work in that space to see whether we can bring that knowledge and expertise to the cancer community. E-cigarettes, which are the new tobacco control challenge, and how we can operate in that space, help our members understand what the science is and what their position should be overall. and addressing inequities, and specifically with access to medicines in low and middle income countries. And you will hear more about those initiatives over the coming months and years as we develop our thinking and our approach on how we address them before they become major problems. Next slide, please. And I said earlier, we have created a virtual UICC through the COVID crisis, and we will continue to extend that so we can connect our members one-to-one and in groups and in, on particular themes or subjects or projects which are important from one part of the world to another part of the world. We anticipate that being a fundamental role of UICC as an NGO in the future. Our reliance on face-to-face may decline as a percentage of our interactions. They will still be important, but we know that the world is moving in this direction. Next slide, please. And we have numbers and things that we try to measure, and our current business plan to 2023, just so you're aware, is growing our membership from 1,200 to 1,300, extending our partnerships around the world to more than 70. We anticipate a slight growth in numbers. We're at 44 at the moment, maybe go up to 50, but we may be spinning off some more organizations in the meantime. We will be increasingly more regionally sensitive and working with different regions on the important challenges that they face, which are specific to those regions. More engagement with members, and of course, we want to see more increased national action in follow-up, for example, to cancer resolution, cervical cancer elimination, improving national cancer control plans, etc., etc. And of course, we have by default, as everyone else has become a hybrid organization. Next slide, please. So I'm going to hand back now to Alessandro. As important as it is to know your views on what we do and how we're perceived, we also would like to know what you would miss if UIC wasn't around. This is always a bit of a challenge, but if you could go, and I'll go to Alessandro, let us know of all that portfolio of work which you're familiar with, which ones would you really miss if UICC didn't do it? So Alessandro, I'll hand back to you again.
Thanks, Gary. And as I said, once again, if you go to menti.com, if you had the page open on your mobile, you should see the next question now. The code is the same if you close that page. So it's menti.com 68352467. And what we want to hear is about what if UICC didn't exist, what would you be missing the most? You've heard all the areas that Carrie mentioned, and it could be a broad key areas we focus, or a specific initiative you're particularly fond of, or a more personal experience you've had with UICC. So feel free to write as much or as many of those areas that you'd be missing if we didn't exist. So maybe let's give it a minute or so to get this answer coming through.
Again, Anil, if you see anything you want to comment on, please jump in.
Lovely to see a reference to friendships and friends, which is nice.
I guess what's coming out loud and clear across all these inputs is about the strong force of bringing everybody together. I can see network, knowledge sharing, convening, online materials.
Yeah, I think you're right, Anil. That's coming through loud and clear.
Yeah, this is, and hopefully we will be sharing this these results with the group here. It's nice for everybody to see what other people miss. So maybe while the entry is still coming through, maybe Carrie and MBL, I'll get the floor over to you again, as I know we will have a more plenary discussion coming up. So there'll be more space for people to contribute.
I like this one too, Carrie, input on new ideas, and that's strong about UICC. All the organizations giving ideas to the regional people who contact us. I think that's another real key area that UICC has stood out on.
Yeah, I agree. I mean, there's some great things in there. So thank you very much, everyone, for putting in your commentary. That's really good. I think we hand over to Maria Barbara now. Is that right?
Yep, that's me. I really pleased to see all those words, because behind our team is always nice to hear that we're doing a meaningful work for all our members and all our community. So thank you so much for your active participation. So let me quickly go through the strategy review itself, the timeline and the process, and what you as members and friends of UICC could expect in the next few months. So we are in March already, and through March all the way through May, we call this phase the data collection phase. So we're just starting at it. For your information, the board of directors, they delegated authority to a task force formed by members of the board to coordinate this process. So we've been working with them very closely and since December last year. So we will conduct data information collection, internal from UICC and external from members, partners, and key actors in the international global cancer arena. Then you could expect also the membership survey. I think Anil briefly mentioned it at the beginning. So as a reminder, we conduct a membership survey every 2 years, and membership satisfaction survey. And we take advantage of that survey on a strategic review years, we ask you certain questions about the strategic review. So the members could expect that survey come in March. So look out, because respondents will enter a draw for a chance to win a free registration on the World Cancer Congress, which, as mentioned, will be held in October in Geneva. We're really excited. And then this is also an opportunity to remind members and other organizations to share with us any documents that you feel are relevant. We will love to hear from you about your own plans, your own strategic plans, and also any other documents that you consider relevant. As you say, as we mentioned, this strategic is to see the future. So if you have any forward-looking cancer documents, any landscape documents on how the world will look in 2035, that would be great to receive. You could reach out to us, to the membership, through the website, to the info@uicc.com also. So please feel free to do so, because as I say, we would love to hear from you, and also will help us to do the data collection phase. After that phase is over in May, we will start the data analysis and the conclusions. The board is getting together in a strategy review workshop in May here in Geneva. So hopefully we could have everybody here in Geneva after the many restrictions we had in the last 2 years. And then we would conduct further research and write up the strategy. By then we would share the key findings with the membership, and we're planning to have a virtual dialogue again, like this one, in May. So stay tuned, because you'll be invited again to join us with some preliminary results. Then we get into the next phase, that is write up and sign off the strategy. So the board of directors will approve the strategy in September, end of September. Then, as Carrie mentioned, we will have to write the business plan to make sure that we are doing, and we are in line also with the strategy in the next 3 years, from 2023 to 2026. And then in October, we will present the refreshed strategy to the General Assembly. The General Assembly will take place in October, also at the beginning of October. You will have more information also, because as you know, the General Assembly is the supreme body of UICC. It convenes all the member organizations, and it's important. It's an important platform for members to be involved and to be engaged in the future of UICC. So that's roughly the timeline, and then yeah, we're looking forward to keep working with you and to keep the good work. And as you could see, we have a busy month coming up, but we're really looking forward to keep working with you and to get this process done and successfully finished. So next slide, please. Yeah, okay. So Carrie, I hand it back to you for some discussion with the participants. So please go ahead. The floor is yours.
Thank you, Maria Barbara. So as you can see there, we will be engaging members through the member questionnaire, but also some reach out interviews with members as well. And that work will be conducted by a third party, which is best practice. So it won't be from me or Maria Barbara, one of the team, it will be but through a third party. And also we'll feedback the earlier thoughts of the board after their board meeting in May and their workshop. Now, this is where we open up for conversation. So what would be great is if those of you can turn on your camera, it will be great to see all your smiley faces. That'd be great. And we have a couple of questions. One is about what do you think the challenges will be for 2030, 2035, that sort of long term that UICC and the board should keep a view about. And secondly, what opportunities you see over the next 10, 15 years for the members and UICC to really start addressing what our purpose statement says now to reduce the cancer burden and also address inequities, which is right in the heart of our purpose statement. So I'm going to open it up, and hopefully we're going to have someone who's going to put their hand up and say, I'd like to contribute. So don't be shy. If anyone would like to give us a view on what they think the important things are over the next 10, 15 years, we would love to hear. And I don't want to pick on an ex-board member, but you never know. Ben's there and Miri's there. I've got Mary in the background as well. So who would like to start off with any views, long-term views on the challenges of facing cancer control? Any hands up? Ben, you're never shy with a view. Come on, Ben. Let's hear what your view is.
So my view, Carrie, is that UICC serves a unique role as the global advocate consortium for cancer. And with a glorious history going back to the starting of cancer staging. And so I think that UICC has a voice for those that don't have voices, and creating that awareness is really powerful. I think that a lot is changing in cancer now. 10 years ago, 15 years ago, so much was considered impossible that you just can't get there from here in sub-Saharan Africa. And we're finding out that's not true. There are things that we can do. And I think that the degree to which UICC really leverages the scientific insight and political insights of how to make this go to the benefit of those that are underserved. I think UICC should continue to do that. One more comment. There are these different communities. There's a clinical community, that's where I came from. There's the public health sciences community, they're my cousin. We have advocacy groups, we have political groups, we have all of these together. And in that way, UICC is multilingual. You're able to translate to these communities that don't talk to each other particularly well, or may not understand each other's vocabulary. So I think that that's really a great strength of the organization. I'm hoping that is helpful.
Well, thanks very much, Ben. I've just seen we've got a hand up from Venus, who's one of our young leaders. So hello, Venus. And perhaps you could put your camera on if you can.
Okay. All right. Hi, everyone.
Hey, how you doing?
I'm good. Yes, I had to park on the side of the road to attend. Okay. My view, I think, as UICC, I think like what the previous speaker has just said, you have that potential to bring all the multiple stakeholders together for better coordination of cancer program. And just looking at the footprint in sub-Saharan Africa, I haven't had much of what UICC does there, but there's opportunities to actually increase access to cancer services, actually opportunity for UICC to be involved in health system strengthening initiatives to actually better cancer care in the long run, because there are partners already trying to.
Oh, have we lost Venus? I fear that we've lost Venus. Okay, are there any other comments?
But now we've seen a shift. Oh, so I believe there's that area which UICC can look at in terms of strengthening cancer care in Africa and sub-Saharan Africa, like maybe in regions. Thank you.
Thank you, Venus. Benda, I can see your hand up. Do you have a comment? Hello, Benda, are you there? Okay, we seem to have a problem there. But does anyone else have any views? Let me just have a look, see who I know on. Did I see Caroline Aldrich there? Did I see Caroline? Is that right?
Carrie, there are some that have come into the chat box. I could see some. Maybe you could read some of them out. It can kickstart a discussion, motivate others to come in and chip in.
Yeah, sure. I'll read for you there. So we've got one. UICC needs to advocate and increase awareness for personalized health care. We've got another one here, which is about people living with cancer and beyond cancer in their leadership to be people-led organizations. Inequity. Inequity is coming up quite a bit as a key criteria. I mean, you'll be aware that the new theme for World Cancer Day is around closing the care gap and addressing inequities around the world. So that's certainly the 3-year theme, but it seems to be coming up more often that we face a decade where there could potentially be greater inequity around the world, and we need to get our head around how we can start addressing that in a more proactive way. So I know that some people have made that point. Any other comments from anyone around the table?
Alessandro, you need to unmute Benda. I can see a message from her. Please unmute me.
I think I can't do it at this end. I think it's something to do with a microphone. I can simply ask to unmute.
Well, we have Cremelda's put her hand up. Cremelda, hi.
Hi, Dr. Guy. How are you?
Yeah, I'm good.
Good. I want to go there also about the inequity about cancer care, especially from the region I'm coming from, which is Sub-Saharan Africa. We are hoping and praying that UICC could, that side of the globe, because the disparity is so wide, the disparity is so wide, and it's about time we start trying to bridge the gap, because here, because of the lack of infrastructure, it's mainly about raising the awareness. It's about prevention and control. So like my foundation, that's where we focus a lot on raising the awareness, because if they know early, we might avoid the whole yard, the surgery, the team comes a lot to my mind as well from this part of the world.
Okay, thank you, Cremelda. I see Andrea Reid. Andrea, do you want to make a comment?
Sure, thank you very much, Carrie. I realize we're talking about longer term strategy here. In Canada, we just refreshed our cancer control strategy in 2019, so right before the pandemic hit. And then we were developing the Canadian Partnership Against Cancer's 5-year business plan that begins April 1st and runs until 2027, shortly thereafter. So what we've had to adjust to, and addressing inequities is a core element of that strategic plan and of our business plan. Of course, then the pandemic hit. And what we're seeing is exacerbation of inequities that previously existed, and the need to build into our 5-year business plan pandemic recovery strategies specific to cancer. And so I'm wondering about the opportunities which we are seeking out here to not just recover from the backlogs created by the pandemic, but to use the opportunity to leapfrog to, for example, different models of care, taking advantage of, for example, the fact that we've adapted virtual strategies very rapidly compared to the uptake of those strategies prior to the pandemic. So there are certainly significant exacerbations of inequities and challenges as a result of the pandemic, but also opportunity to think differently. And so wondering about UICC's role in surfacing some of those opportunities and sharing best practices over the coming years as we collectively recover from the pandemic.
Andrea, that is that commentary you provided there was probably the last board meeting. We had a very similar discussion about, what are those silver linings coming out of the COVID pandemic? What have we seen adaptive practices? Have we seen new technology? Have we seen remote support? What can we share around the world to make a difference and accelerate, the interactions with patients, particularly? I thought Lauren Huber was online. Is Lauren, are you there?
I'm here.
Lauren, I mean, your space is tobacco. I'm sure everyone knows you very well, but I mean, what's the forecast on tobacco then? What do you think about the risk factors more generally?
Well, as a risk factor, obviously accelerating the implementation of the FCTC continues to be an issue. But I think there's other opportunities, for example, endgame around tobacco. As you know, a number of countries are now really established very low prevalence rates, including with the EU cancer plan. We're currently in Europe about 20% and try to get to 5% or below. New Zealand has a very strong plan in place. So I think UICC could play a very useful role in that field and around supporting endgame, especially as an organization that has a tremendous amount of credibility and is taken very seriously. And I think it's a field that's gaining momentum, but it's still in the early stages. Even when the next conference of the parties of the Framework Convention on Tobacco Control, Article 2.1 of the treaty, which is the article that calls on countries to go beyond the current articles in the treaty to protect the health of its citizens. So the fact that it's going to be in the agenda for the next COP at the request of Canada, the government of Canada, with supports from other countries that have an interest in endgame, including Panama, for example. And we see so much momentum. And I think this could be an area where UICC could help a lot of credibility to that movement.
Laurent, wouldn't that be great? Endgame to tobacco. Thank you very much for that, Laurent. Quadas, I just see you got your hand up.
Yes, thank you very much for giving me the opportunity to speak. When we talk about cancer care gap, there's a lot of gap, especially in these parts of the world, in sub-Saharan Africa. A lot of areas to focus on, but one that is critical, which we may not have been looking into, is that of skilled manpower. There are countries in sub-Saharan Africa without gynae oncologists. There are countries where there are just one person managing over millions of patients. So UICC should look into how we can help build manpower through exchange programs, through building manpower through exchange programs, allow members from sub-Saharan Africa exchange program to improve skills in this area, and probably get professionals to come down from high income countries down to sub-Saharan Africa to train specialists in practicing in sub-Saharan Africa. Thank you.
Thank you very much. Gamal, I can see your hands up. Gamal, are you there?
Hello?
Hello, yes, we can hear you.
I'm speaking from Dallas. I'm attending the SSO meeting for surgery. My point of view is that there is now very marked progress in the genetics and molecular biology and recent advances in the diagnosis of cancer and its impact on the treatment. Now the drugs and pharmaceuticals are very expensive in the management of cancer. The chemotherapeutics and the immunotherapy are very expensive. I wonder if the UICC can have idea about the cooperation with pharmaceuticals and big companies to reduce or to help the developing countries in this aspect, because the numbers are increasing and the budgets of the states cannot control or cannot go on with the expenses of these drugs.
Kamal, that's a very strong point, and it's on our desks at the moment, and we're considering options on that. So we may be making some announcements in the next few months on that particular issue. Thank you very much for that. John Kerr, I can see your hands up.
Yes, thank you, Gary. I think that UICC have the comprehensive and coordinated strengths to have political commitment, to have that cancer still will be a priority. Now you have politicians using money for climate change and for armed forces. So we have to join forces that the cancer is on the top agenda at the political level. And in Norway this year, we will start a new strategy for a national cancer plan. And so the timing is perfect so we would like to contribute. Thank you.
That's great, and always good to hear a country having a new cancer plan in these very difficult times. Dr. Habibullah, is that right?
Thank you very much for inviting me today to join this beautiful program, because I am attending this program for the first time. In Bangladesh, we have experienced a lot of progresses in upgrading the cancer treatment facilities like radiotherapy, chemotherapy, surgical skill, and others also. But all the programs are focused on treatment, and also that's are also highly centralized in the capital city and the major great cities of our country. But we are still lacking a national cancer control strategy, plan of action, and the program, and we have no population-based cancer registry still. I am the head of the Department of Cancer Epidemiology at the National Institute, but still we have started a hospital-based cancer registry since 2005, but we could not start a population-based cancer registry, and we don't have any organized cancer screening program. There are opportunistic programs, but my proposal is there any scope from UICC that we can organize some advocacy programs in collaboration with UICC by the member organization. I am also representing an organization that's in the patient mentoring group category. So can we organize some sort of advocacy program or some program in collaboration with UICC and other also participation from our neighboring countries or other countries? Is this possible for UICC to support this type of initiative so that we can motivate the policymakers and also our colleagues in clinical oncology? That was my concern. And again, I like to thank you.
Thank you very much for joining. One of my team will reach out to you, and we'll see what is possible. Okay, so we'll pick that up, and one of the team will reach out to you. Now I'm looking at the time. So Balaji, 1 minute if possible, because we need to hand back to Anil D'Cruz to do a summary. So Balaji, do you want to talk?
Hello?
Hello.
Hello, are you hearing me?
Yes, we can hear you.
Yes, I'm speaking from Nigeria. So I want to speak from Africa. And presently, there are a lot of problems militating against cancer management in Africa. And I feel that if you want to close up the cancer gap, the UICC should need to shift attention to Africa, especially Nigeria. Because presently our patients, of course, one of the challenges we are facing is that they come at advanced stage, and there's no equipment, poor education, and even for chemotherapy drugs, we couldn't lay our hand on them. So please, if the UICC can shift focus to Africa, I think it will be better for us.
Okay, thank you very much. Well, I'm going to hand straight over to Anil D'Cruz. And before I do, just say thank you very much for those who contributed. And we've captured all the chat commentary as well. But if any of you want to follow up and feed comments straight into the team, please feel free, drop us an email. Anil, let me just pass over to you. Any thoughts or views from what you've seen and heard and read?
Thanks, Carrie and Maria and the whole team, Muriel, for really putting a good session together. Your commitment and the commitment of the team stands out, Carrie, and I can see that you wear UICC on your sleeve. I noticed the orange sweater on, and that's always I'm sorry. That's always a session. That's always inspiring, and you can see how I've been inspired. I've hung up an orange drape behind me to how your passion invigorates all of us. But it's been a great 1 hour discussing. I was jotting down a few points that I thought I gleaned from today's discussion, and when we looked at the adjectives that described UICC as a person and what would you miss about UICC, I think what came out loud and clear to me is that we are an organization that tries to make a difference. We get people together, get ideas together, put it on a world stage, and I think we are the catalyst, and I think we need to build on that. What have I learned, or what were the ideas that came out today? There were some great ideas, and I'm not going to go through all, but inequities came loud and clear. The focus on regional activities, probably we need to focus on that and strengthen our presence regionally. And I think the one that really stood out for me is innovations. It's something that we've learned, and maybe the COVID pandemic, and as you use the word silver lining, has taught us many things, and maybe we can incorporate some of those learnings as we go across in cancer control. So quickly to summarize, Maria shared the timelines with us. All of you all present, all members, and even non-members are welcome. Finally, we are all one big family in this fight against cancer control. We have till May. And I'd love you all to send your inputs into the membership team. It could be any kind of resource, any kind of thought. It could be have regional outlook, global health, civil society, engagement, political, whatever you have. And it'll help us as the strategic task force and the board of directors to then take out the salient points from them, put it together, polish the document, and present it to you in October when we meet face-to-face at the World Cancer Congress. So thank you once again for this interesting 1 hour, and thank you all for making it for today's program. I enjoyed myself, and I'm sure you'll all did. Thank you, and back to Maria and the team.
Thank you, Anil. And just a few words to close. Actually, a few words of thank you for all your active participation, for joining us, for sharing your ideas. And you will hear from us. As I mentioned, you will be receiving the member organization, will be receiving the membership survey very soon. So we look forward to receiving your answers. And then publicity, with next Tuesday, 15 March, we'll have a UICC capacity building cafe. I encourage you all to attend. And then, yeah, enjoy another virtual dialogue with the UICC family. Apart from that, thank you again. Thank you very much. And we're looking forward to this process, and we're looking forward to working with you. Thank you so much, Carrie. Thank you so much, Anil. And thank you so much to the members of the board. Thank you so much for the member organization, partners, and friends. Thank you. Have a good afternoon, good morning, and good evening. Thank you. Bye-bye.
Thank you, everyone. Bye-bye.
Bye. Thank you very much.